my hands like this underneath, almost like those occipital pads that you just saw with the traction unit, okay? And I'm essentially going to distract. I use my best estimation, and I use the patient's response in terms of how much pull is adequate and effective. What do you think I'm looking for? What do I want to occur with traction? Pain reduction, possibly what else?
Centralization.
Centralization, yeah. Or at least I want to decrease the peripheral symptoms that they're having into their arm, much like what we've talked about with the lumbar spine. Okay? So my hands underneath, I kind of catch your occipital condyles there, and I'm just applying a little bit of distraction. Okay? Again, what we talked about earlier for those patients that have really forward head postures and they lack a lot of this length in their suboccipitals and they can't lay down and be flat in a nice neutral position, that's when I might need a pillow or a towel here or something to at least keep them neutral, because I don't want to be distracting if Caitlin laying down like that, right? Okay, so nice flexed, almost like in that chin tuck axial extension position, distract. And then again, whether I do it statically for 5 minutes, whether I do it intermittently, is pretty arbitrary, okay? But typically, if I'm doing this manually, I'm doing some distraction with maybe some suboccipital release, with maybe some joint mobs, with maybe some soft tissue stuff, and I'm kind of doing a lot of stuff at once. So I'm not going to sit here for 8 minutes and distract, okay? Or I'm going to put her on the machine to do that, because that's much more time efficient for me. Does that make sense? Okay.